Pico dressings are a type of single-use negative pressure wound therapy. They apply negative pressure at 80 millimeters of mercury evenly across the dressing through a wee pump. They can manage a moderate amount of exudate by absorption into the dressing and through evaporation of moisture through the outer semi-permeable film. Pico dressings are indicated for use in a variety of acute and chronic wounds. They're suitable for use in open wounds that are shallow, so less than 0.5 centimeters deep, but can also be used in deeper wounds with a gauze or foam filler. In ICU, we most commonly see them used on closed sternotomy wounds following cardiac surgery. Contraindications for Pico are similar to other negative pressure wound therapies, including known malignancy in the wound, osteomyelitis, unexplored fistulas, and exposed blood vessels, nerves, or anastomotic sites. It's really important to note that the pump contains a magnet, which means that it must not be placed close to other medical devices that could potentially interfere with. These include pacemakers, ICDs, insulin pumps, shunt valves, and cochlear implants. It's also not compatible with MRI, so the pump needs to be detached before taking a patient to MRI. Often patients arrive in the ICU with a Pico dressing already in place, but occasionally we are required to apply or change them. Prior to doing so, ensure the wound bed has been cleaned using aseptic technique. Then remove the backing plastic and place over the wound bed. The port should be placed higher than the wound bed, over intact skin and not over the wound itself. Once the dressing is in place, you can connect the pump to the long tubing. Then press the orange button to start. You do not need to change any of the settings on the pump. The pump should be checked periodically to ensure the green light is flashing. This means it's doing what it should. If, however, an orange or red light is flashing, or there are no lights flashing at all, then you'll need to do some troubleshooting. There are 3 lights that indicate there is a problem. This first one tells you that there is an air leak. In which case you need to look at the edges of the dressing to assess where the seal is lost and reinforce these areas with the extra dressing supplied or with Tegaderm. Take care not to cover the middle area of the dressing, as this will interfere with its ability to allow moisture to evaporate. If the second light is flashing, the dressing needs checking and may require changing. Dressings can last up to 7 days, but should be changed if the exudate has filled 3/4 of the absorbent pad or is around the port. If the third light is flashing, the batteries need changing. And if all of the lights are flashing, there is a problem with the pump and it may need to be changed. Finally, if no lights are flashing, the pump has reached the end of the 7-day lifespan and the pump and the dressing need to be changed or removed. Removal is really easy. The silicone backing makes removal atraumatic. And when disposing of the Pico, please ensure the batteries are removed and disposed of separately. So to recap, the key points: Pico is a single-use negative pressure wound therapy. The pump contains a magnet and must be kept away from other implanted medical devices and MRI. If a green light is flashing, you're all good. If an orange light is flashing, you need to check the seal or change the dressing. Choice.